Hello, friends and patriots, and welcome back. This week's big news: U.S. President Donald J. Trump and his wife, First Lady Melania Trump, have both contracted the COVID-19 virus. This has temporarily thrown the ongoing presidential race into new uncertainty and has added yet another form of novelty to perhaps the most novel election in U.S. history. If you thought things couldn't get any more unpredictable, think again. And this while there's still about a month left to go before Election Day. What follows is a brief outlining of my views on this significant news event, as well as a few points I will be keeping a lookout for to develop in the following weeks. So let's get started with the facts. The President of the United States and his wife, the First Lady, have both tested positive for the COVID-19 novel coronavirus. This follows earlier news that an assistant to the president, Hope Hicks, also tested positive for the coronavirus after traveling with the president during his recent election campaign stops. Finally, there's even more news that the president's new campaign manager, Bill Stevens, and former campaign advisor Kellyanne Conway have both also reportedly contracted the virus. President Trump has sent out a video message to the nation.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it. Thank you.
The White House has confirmed that the president will remain fully in charge and will perform his presidential duties himself while he recovers. They are giving the president antibodies while he fights off the infections. There's been a lot of hysteria in the leftist media and in, surprise, surprise, Democrat-administered government circles about the Chinese-originated novel coronavirus. The media, of course, have from the very beginning always sought the most sensational aspects of the pandemic, including an obsession with presenting a major city-centric view of the lockdown for dramatic effect, at the expense of showing the rather different experiences lived by many more citizens in the suburbs and in rural America, and their decidedly not overwhelmed medical facilities. This frenzied focus on big city failures like New York filled the airwaves night after night. All the while, these very same news establishments simultaneously downplayed or simply failed to cover the inept and often totalitarian-minded responses coming from Democrat autocrats like New York Governor Cuomo or New York Mayor Bill de Blasio. Couple this media distortion with an almost pathological preference for reporting on the most wildly pessimistic predictive models they could possibly find, along with filling their news with hypothetical worst-case conditionals about what might, could potentially, and may possibly lead to prognostications about happenings that in the end mostly didn't come to pass. Given all this, it's easy to see how many Americans came to have a distorted view of just how bad things were, or weren't. And then there's the almost exclusive focus on the death counts in the leftist media and on the part of opportunist Democrats. The vast numbers of citizens who have been infected with the coronavirus and then completely recovered are nowhere to be found. As three-time Democrat presidential candidate Joe Biden tried to do during the first presidential debate earlier this week, it's all about the dead, the deaths, and the victims. When President Trump and First Lady recover from the Wuhan flu, they can serve as living proof that another side of the story exists, which rarely gets reported. That is, the vast majority of Americans who have come down with the coronavirus, but then also recovered completely and returned to their regular selves. And in addition to the millions of Americans who actually did suffer from symptoms stemming from a COVID infection, there exist millions of additional Americans who were, quote, infected without suffering from any debilitating symptoms at all. The president and his wife can serve as public, personal embodiments of just such cases that overcame the virus to get back to their families and get on with their lives. A healthy President Trump, uncontrolled by the leftist press, could shift the focus finally away from deaths to recovered cases, exactly where the focus should now be. Another point to keep in mind is perhaps the president's experience can help to break the leftist media's stranglehold on many important scientific facts that simply aren't being reported by the press due to their positive, rather than dire, implications and consequences. These facts include the number of COVID-infected citizens who, throughout their experience of infection and recovery, were asymptomatic and showed zero signs of physical or mental debilitation. Revised CDC reports that belatedly reveal the fact that Americans who have died from coronavirus already had, on average, almost 3 additional and separate life-shortening pre-existing medical conditions manifesting in themselves before they ever caught the China virus. Don't forget, too, that since COVID-identified patients, and especially COVID-identified deaths, often provide opportunities for increased financial remuneration to medical clinics and hospitals, benefits which other, more common conditions like obesity or heart conditions simply do not provide, there is a strong incentive on the part of hospitals and doctors to focus on COVID as being the cause of death. Nevertheless, the number of people who died solely from coronavirus is, compared to the total numbers being promoted in the press, still extremely small. What follows is the current head of the Centers for Disease Control and Prevention, Dr. Robert Ray Redfield, Jr., admitting to just these types of financial incentives and the negative implications they can have on COVID case and death diagnoses.
One of the things that concerns me also is I wish that Admiral Guar was here yet. I asked this question of him last time was here, and we didn't have enough time to continue our discussion on it with regards to the sort of perverse incentive for the medical folks to claim that somebody died of COVID versus if it's an automobile accident, for instance, as long as you have COVID in your system, you get to claim it as a COVID death, in which means you get to get more money as the attending physician, hospital, whatever. And he acknowledged that the statistics he's getting from the states are overinflated. We found that the governor of Colorado, who is a Democrat, actually did a research on this and found he had to get rid of 12% of the deaths that were recorded in state. Dr. Redfield, would you like to comment on that a little bit about the perverse incentive, and is there an effort to try and do something different in the way that these deaths are recorded so we actually have better records and better numbers, better data to go with?
Thank you, Congressman. I think you're correct in that we've seen this in other disease processes too. Early in the HIV epidemic, somebody may have a heart attack but also have HIV. The hospital would prefer the DRG for HIV because there's greater reimbursement. So I do think there's some reality to that. When it comes to death reporting, though, I mean, ultimately, it's how the physician defines it in the death certificate. So I think it's probably less operable in the cause of death, although I won't say there are not some cases. I do think, though, when it comes to hospital reimbursement issues for individuals that get discharged, there could be some play in that for sure.
Thus, by using a refocus on the number of recovered cases compared to the total number of infected, the Trump administration could begin to more positively gauge just how well or poorly America under the Trump administration is doing. After all, it's a fact that, setting aside deaths, the U.S. is also number 1 in total cases, but more importantly, in successful recovery totals. If Democrats insist on a cynical and laser-like focus on total deaths to the detriment of all other numbers, we could still use this to point out a positive aspect to which the Democrats will never admit. When one compares the percentages of deaths versus total infections in the U.S., it becomes clear that the U.S. is doing much better than many other advanced nations. Who knows, this might lead to a wider understanding of the fact that, if you go by deaths versus overall cases, the U.S. is one of the best places to get infected with the China virus, since you are far more likely to die of COVID in other countries than in the U.S. One would think that countries like Germany, the UK, and even leftist utopia Sweden, countries that have socialized medical systems so desired by a government-fetishing Democrat Party, would be doing a much better job at keeping their patient-to-death ratios below America's. But no, it's a fact that that just isn't the case. Finally, I mention in passing the disgusting glee to which leftists and Democrats have treated this news. It's beyond disgusting and shows that for leftists, even sickness and deaths are things to be celebrated, provided they happen to the right person or provide political benefits perceived or real to their side. Talk about being infected with the Trump derangement syndrome. For the vast majority of American citizens out there, the last thing on their minds is to crow about the president coming down with a globally spread infection. Only yesterday the left were virtue signaling about how serious the pandemic is and how the administration hasn't taken it seriously enough, even though they have. Today they're dancing all over Twitter and Facebook. Such optics and such pathological cynicism and hope for harm on the part of the left will not play well with the silent majority. And let's not forget, Joe Biden has 100% been exposed to the virus too. There's no question about this. According to Follow the Science Biden, he should not only get tested, but should cancel all his in-public appearances and go back to cowering in his bunker for at least another 2 weeks of self-quarantining. When you know you've been exposed, Joe, wearing a mask isn't patriotic enough. Back to the basement with you. Thank you all for listening. Please like and subscribe, and maybe I'll post more content in the near future.